Hi, I'm Rob Boardman and I am the Head of Learner Experience as well as a mental health first aid trainer here at 3B Training. So I think that it's important that we create a culture both in society and within our organisations where talking about mental health is something that people feel comfortable doing. And I think that's for a couple of reasons. Firstly, for a lot of people, that will be a coping mechanism for them and an outlet for them to be able to talk about the way that they're feeling. But also for organisations, it allows them to better understand their staff, to better provide help, support, guidance for their staff, and ultimately to create a better working environment. Okay, so when we're thinking about what kind of encouragement we could give to people who want to open up about the mental health, for me, the first thing to consider is that there's no black and white or right or wrong answer for anyone in terms of how they do that. People will be at different stages of their own journey. So for some people, they may not be ready to talk about the mental health at all, and that's completely okay at that point for them. What it's about is creating that open culture that allows them to do that over a period of time. So we may also find that people are more comfortable talking to one person rather than another person. So for someone, that, yes, could be somebody in the workplace, a colleague or a manager. But for others, that might just not be the environment they're comfortable talking about mental health in. They may go to the GP, for example, or to a mental health professional. So what I would say to anyone who's sort of thinking about how they can open up about the mental health is that there are a number of different options out there, and it's not a one-size-fits-all approach. I think the final thing that I would add is that if you are somebody who's concerned about somebody else and you want to have a conversation about mental health, you don't necessarily need to be a mental health professional to have that first stage of the conversation with them and to just start talking. They might be somebody who has never been approached about this before. You might be the very first person to ask them about it, and it could make a real difference and be that catalyst for them to go on and have further conversations, and yes, later on, access the appropriate help and services that they need. Ultimately, though, the only way we can do that is to continue to create a more open culture in our organisations, throughout society, where talking about mental health is something that's much easier to do.